Hey, Rita here. I wanted to talk about the patient encounter with Mr. Bailey. Basically, his labs show that his LDL cholesterol was high at 165, and according to the National Institute of Health, it should be under 100. So that's a flag right there, and that could be associated with cardiovascular disease for Mr. Bailey. Also, his triglycerides were really high, in the high category of 330 versus 150 at normal levels, which is also the start of heart disease or possibly heart attack. And his hemoglobin A1C is considered pre-diabetic at 6 versus the normal ranges of 4 to 5.6. Basically, some things that are happening, contemplating based off his living situation, his work situation, and his eating habits. It appears he's eating excessive amounts of sugar or processed foods with the airplane food that he consumes, and it looks like there's a high amount of saturated fat in his diet based off of his triglyceride levels. Some recommendations that I gave to Mr. Bailey are considering the Mediterranean diet. That will overall help with reducing the bad fats and understanding what good fats are to increase his HDL, and overall eating whole and healthy foods. So I gave him a source for that, as well as looking at the American Heart Association diet. Has a lot of recommendations on helping to lower triglycerides. So based off the 3 labs that I received, I'd like to check his other labs that I didn't get to see, which would be his HDL, to see where that's at to help increase that, and get his total cholesterol score. I also would like to request, since his triglycerides were high, possibly looking at his liver enzyme test, ALTs and ASTs, to ensure that there's no other diseases possibly present, or he might have pancreatitis. Also, his A1C is pre-diabetic at 6, so once he reaches 6.5, he'd be considered diabetic. So I'd like to see a further test, possibly once I put him on lower sugars or more whole foods, that he retest his glucose at a fasting level, to see if that comes down out of pre-diabetic stages. Sometimes the liver enzymes, according to the research, can affect the A1C test. So I would definitely want the liver enzyme panel as well. And then lastly, I'd like to request his anthropometric measurements to review his BMI and see if he's overweight, which is a factor in high LDL and high triglycerides, as well as high A1C. Based off some of the questions that I'd like to review with Mr. Bailey is, how willing is he to make these dietary changes at this point in his life? What are 2 things that might prevent him from making some dietary changes, like going on the Mediterranean diet, or just incorporating some more healthy fats in his diet? And based on the changes on what we need to do to create health, should we do first, and what is he willing to do first? Basically, what stage of change is he in? I explained to him about the risk associated with having these high levels and where he's at in his health, and intervention in making these changes is necessary if he wants to live a healthier life and not be at risk for heart disease. I also would like to ask him if he's able to see a dietitian based on his schedule when he's in and not flying, at least once a month or once every other week when he's here, to do check-ins, and to make sure he gets the help that he needs and support he needs. The other thing is, how is his work really challenging? Well, based off the statistics of high triglycerides, really affecting his health. We talked about how his work does not let him have breaks. It limits his accessibility to healthy foods, his time constraints to eat his food, to chew it properly, and even going to the bathroom, as well as physical overall activity, since he is sitting on an airplane most of the time. So how can we get some of these changes done with all these factors in his life, and his job being a big part of his life? So we talked about different ways that he can work on time management when he is home, how he can meal prep his foods and bring them on the airplane, and how he can get access to more physical activity, whether it's walking around the airport when he's on his breaks, and being able to have adequate staff to help him when he needs help or needs food or whatnot when he is the pilot of the plane. Anyhow, thank you so much, and I hope I answered all the questions for Mr. Bailey.